today. So welcome everybody, and thank you for joining us for the third webinar in our policy series where we're talking about elder economic security today, a subject that's near and dear to my heart and that I'm really excited to share with you today. So just a few housekeeping items. We are doing this through the Zoom webinar platform, and all of you who are joining us as attendees are without video and you are on mute. And so please do use the chat box. We will be monitoring that throughout the conversation. So please do use that to ask questions and to raise any concerns or statements that you'd like there. And we'll be monitoring that and responding to you there, as well as posing your questions to our presenters at the end of the presentation for a question and answer session. And those of you who've joined us for our previous webinars will know that this series has been sponsored by Archer Law Offices, and we're grateful for their support and for their partnership. And we have with us today Tom Callahan from the Archer Law Offices, and he's going to tell us a little bit about their services before we launch into today's program. So, Tom?
Good morning, everyone. Thank you, Melissa. Archer Law Office is very proud to present any of these series offered by the New Jersey Foundation for Aging. They're so very informative. Archer Law Office is a firm dedicated to elder law and caregivers. We have 4 offices here in New Jersey: Bridgewater, Hamilton, Jamesburg, and Moorestown. We handle the basic things like your wills, your power of attorneys, your advanced medical directives. We also have a crisis department, because we all know everybody plans to retire, but very few people plan to age. And with that comes a lot of issues that develop with families not knowing what to do with mom and dad. So our firm is actually set up to handle those issues, to get everything settled out and to move people to where they need to be and make sure they're getting the services they require.
Great. Thank you so much, Tom. Again, happy to have the support of Archer Law Office and happy to have you join us today for the webinar. So thank you very much.
Thank you.
I'm even more excited to tell you about our presenters today. Jan Muchler is a professor of gerontology at the McCormick Graduate School of Policy and Global Studies and the director of the Center for Social and Demographic Research on Aging at the Gerontology Institute at the University of Massachusetts in Boston, and is our go-to person for national-based information about the Elder Index. And Dennis McGowan is the manager of the Area Agencies of Aging Administration for the New Jersey Division of Aging Services, and we're happy and pleased to have them both with us to tell you a little bit more about this topic. But before I throw it to them, a couple of things. First, I have a poll that I want to pull up and ask everybody if you wouldn't mind answering a quick question for me about whether or not you've heard of the Elder Economic Security Standard Index, which we refer to briefly as the Elder Index. This is a report and a topic that's very near and dear to the New Jersey Foundation for Aging. We were the lead state organization in New Jersey to bring the Elder Index here in 2009, and we published several reports and did a series of outreach and education related to the Elder Index over the past several years, prior to legislation in 2015 that mandated the use and updating of the report by the Division of Aging Services. And that's why we're so grateful for our partnership with them and for Dennis joining us today. It looks like, wow, we're getting great responses from the poll. Thank you so much for everyone who's been answering. We have surprisingly, Jan, not everyone in New Jersey does know about the Elder Index. We've 39% of people said yes, which is a good number, but 57% of them don't, and 4% said maybe. And I put maybe as an option because I thought people might have heard about it, but maybe they don't know enough about it and what it is, which is why we're so glad that you're both here today to tell us more. So before we get into the nitty-gritty, I'm going to pass it to Dennis to do an introduction and some remarks before we turn it over to Jan. So Dennis?
Great, thank you. And I'll keep mine very brief because Jan has all the good information. But I just want to acknowledge both UMass and the New Jersey Foundation for Aging for their pioneering work on this effort. What you're going to hear today is really very interesting and useful data that no one else in the world is collecting. It's in so many different spots, and this effort really brings it all into one place and gives us really good data that's for that population that's above the poverty line. so many things we do are really geared toward and based on poverty level, which is really not where we want folks to be heading. We want people to be, in a more affordable lifestyle. And this project and effort you're going to hear today is going to talk about data that leads us there. And then a little bit later during question and answers, we'll talk maybe about some of the programs that help people afford New Jersey a little bit better. So thank you very much for being here and for having me on your panel.
Thank you, Dennis, for that. And yes, such useful information. And we do want to make sure that as part of today's conversation, we talk about the things that New Jersey is doing as a state to make sure we're caring for everyone who's attempting to grow older in New Jersey. And so as we do that, we'll hear, for those of you who aren't completely familiar with the Elder Index, our presenter, Jan, is going to tell you all the things you need to know and didn't know you wanted to know about elder economic security. So Jan, I'm gonna exit myself here and turn it over to you. So.
Very good, thanks. Let's see if I can get my screen share going. There, can you see my screen okay?
Sorry, I muted myself. Yes, I could see it.
All right, great, thanks. Okay, well, I'd like to thank Melissa and the New Jersey Foundation for Aging for inviting me to this. I have been working on the Elder Index and elder economic security issues for a very long time, but New Jersey has always been a real leader in this area. And I've spoken with folks in your state a number of times about this, and it's just always such a pleasure to hear what you guys are doing and to share what I do with you. So again, thanks for the invitation. I'm going to be sharing today a summary of the 2019 Elder Index, and that is just a little heads up. What the Elder Index is a cost of living measure for older adults. And I'm going to be telling you how we use the Elder Index to learn about economic insecurity among older New Jersey residents. And I'm also going to talk just a little bit about what we might see moving forward. But before we start, and this is, Melissa explained, I'm in a gerontology department, so we do all of our work relates to aging. And because of that, and also just because of the times, we really can't give hardly any presentation without talking about the COVID crisis and what that is doing to the older population and what it means for the kinds of things that we care about. So we need to acknowledge the times that we're in. So much of the messaging around the COVID crisis relates to the implications for health, for mortality. We know that even though nobody is completely without risk, some people have a lot greater risk of struggling with those medical issues than others. The national data from the CDC that I just looked up this morning suggests that more than 218,000 cases and more than 16,000 deaths have been reported in New Jersey. And I also went to your Department of Health website, and that shows that older people are at higher risk of death and hospitalization. Persons of color are at higher risk, and risks are far higher in some communities than in others. Those kinds of observations we would see if we went to any state's Department of Health website. I see it in Massachusetts, we see it in other states. So those are commonalities that older people are at particularly high risk of these dreadful consequences of the virus itself. What we are just now beginning to analyze and attempting to understand is all of the fallout impacts of COVID for older people, what people are experiencing that goes beyond their risk of dying or becoming ill. We know that many older people have lost their jobs because of the economic downturn following COVID. We know that businesses have closed, people have become laid off. And again, we hear a lot about that in the media around younger populations, but older people have been wrapped up in that as well. New data that I'm going to share a little bit with you shows that people's emotional health is taking a hit. People are experiencing a lot of anxiety, a lot of worry, a lot of depression, and just a lot of uncertainty. And again, older people are being impacted by those as well. I'm going to return to that theme back toward the end of my presentation, but the bottom line is that older people are being heavily impacted by COVID, not just in terms of health consequences, but also in terms of their financial security. And so that issue that we're going to be spending our time on today is more important than ever. So the outline for my presentation today is I am going to tell you what the Elder Index is, and so now you will all know about the Elder Index, and I'm going to give you an overview of the Elder Index for New Jersey. I'm going to share some data about how different New Jersey counties compare in terms of the cost of living and also in terms of economic insecurity rates. And then we'll return to that COVID-19 issue and the financial fallouts, and we'll have time for questions and discussion at the end. Before I jump into the data, I want to share a real life story with you. And this is a piece that appeared in the Boston Globe a couple of years ago. And it really was a story that launched off of our work with the Elder Index. So the woman profiled here is named Judy, and she's 74 years old. She lives in Boston, and she's among nearly 300,000 Massachusetts residents aged 65 and over who are struggling to pay their bills. The story was all about her and her financial struggles. What's striking about this case is that Judy has a college degree. She worked for virtually all of her adult life. Now she lives in public housing, and she relies on an annual income of just about $22,000. That income is made up mostly of her $1,460 a month Social Security check, and then she has a $400 a month pension. The article says about Judy, between rent and groceries and medical costs, she says she's lucky if she has any money left over at the end of the month. When a new prescription for a bladder condition upped her expenses by $55 a month, she stopped filling it. So this is an example of a person who, she's not poor. She worked all of her life. She even has a pension. She has some benefits that she receives in the form of housing subsidies, but she can't make ends meet. The only option she's aware of to bridge that gap between what she can afford and what she needs is unhealthy choices. So she, in this case, the story talks about her cutting her medications. Other people may cut their food consumption. They may not use heat or air conditioning to the degree that would be safe, a variety of consequences. I'm sure that everyone listening has encountered these kinds of situations in the work that they do. This is very common every time I talk about this issue in Massachusetts. Certainly, people tell me that this is a very familiar narrative that they encounter frequently. And this really is the focus of our work on elder economic security and the Elder Index. As Dennis mentioned, we really are trying to figure out how much does it actually cost to get by in later life, and what does use of that metric tell us about economic insecurity among older people. And it also helps us begin to imagine how we can do better, how we can promote financial security among older people in our states and communities. So this image is just meant to really help us conceptualize what we're talking about when we describe economic insecurity, or we use that term. We think about the balance between resources and expenses. There are expenses that everybody has to cover. Everybody has to cover food and medical expenses. They have to cover housing. They have to cover other necessary things in order to get by. And everybody has a certain pool of resources. Very often, and what we're trying to do when we're measuring economic insecurity is we're trying to develop an understanding of how out of balance are resources relative to expenses. How many people struggle with that balance being out of whack. And so with the Elder Index, what we're trying to do is develop a metric that will tell us how much does it actually take in order to get by? What do those expenses need to be? So That's where the Elder Index comes in. The Elder Index measures the income that is needed by older adults to maintain their independence and to meet their daily living expenses. And the Elder Index has some key features that it's important to be aware of. It summarizes how much it costs to get by, and it's built around everyday expenses that are encountered by older adults. Now, these points are really important because it's meant to think not just about, it's not meant to summarize how much do you need to save in order to live for the next 20 years. It's not meant to really summarize how much do you need to have in order to replicate your lifestyle before you retired. It's really meant to be a bare bones budget, just what you need in order to get by. We talk about it in terms of what does it take for you to be able to stay in your home and stay independent. The Elder Index assumes no needs-based supports or transfers. So even though people at different levels of the income distribution may be eligible for things like subsidized housing like Judy was, or for SNAP benefits, we don't take any of that into account. In the Elder Index calculation, we want to know how much would it cost for people to get by if they had to pay for everything out of pocket. It assumes that people are living independently. And in fact, most older adults do live in either a one-person household or a two-person senior-only household, but those are the types of households that we focus on. And importantly, we calculate the Elder Index county by county for the entire United States. So in that respect, in all of these respects, but particularly highlighting the last one, these are things that make the Elder Index very appropriate for understanding economic insecurity among older people and unique in its ability to capture that information. So let's start looking at some data. So the 2019 Elder Index, these are the most recent data that we have released at this point. I'm going to share with you a table that has a lot of numbers. And so before I put the numbers in, we're going to talk about the tables so it's not quite so overwhelming. I'm going to share information about the Elder Index for the New Jersey state. So it's a New Jersey average, and that's really just a weighted average across all of the counties in New Jersey. When we calculate the Elder Index, we develop estimates essentially for all of the boxes that you see in this table. We calculate it separately for an older person who's living alone and for an older couple. Again, both of those individuals need to be age 65 or older. Typically, in more than 90% of the cases, a two-person elder-only household is a married couple, but they need not be. We don't require that in our calculation. We generate estimates for three different household or housing statuses, people who own a home without a mortgage, people who rent a home, and people who are owners with a mortgage. For renters, we assume we use fair market rents, and we assume it's just a one-bedroom unit. Then within each of these cells, we calculate the cost of housing, of food, for transportation, for healthcare, and miscellaneous. And you'll note in healthcare, I put good health. We also make these calculations assuming three different levels of health, excellent, good, and poor. And all of the data that I'll be sharing with you today assumes good health. And then having calculated these things, we add them up and we have essentially a monthly budget based on the Elder Index, and we can multiply it by 12 and we have an annual budget. So when we do that, this is what we get for New Jersey. Now I know these slides are going to be shared with you, and you can come back and watch the taped version of this. And so I won't leave too awful much time, but I think that you can see very clearly some patterns here. Clearly, it costs more for an older couple than an older person living alone to get by. But if you sort of start doing some calculations in your head, even just a little bit, you'll see that it's not twice as much. And that's because there are economies of scale. It does, in fact, cost less for two people to live than for one person for two people to live alone costs more than for two people to live together. The exception is in terms of healthcare. It actually does cost twice as much in terms of healthcare. But you can see that the range of estimates for the elder index in New Jersey goes from just over 28,000 for an owner without a mortgage up to nearly 52,000 for a couple owning a home with a mortgage. And then we have just everything in between. Okay. All right. So this is the same information on the left-hand side of your screen. We see that same information put out in a chart so that we can begin to compare some of these values. And on the right, you see the U.S. average. So when jumps out to you right away, I'm quite sure, but when we compare the elder index for New Jersey for that for the US as a whole, we see a big difference. And essentially we can just say, well, gee, it costs a lot more to live in New Jersey than in the average state. And what these numbers suggest is that for owners, single owners with no mortgage, it costs about $7,000 more in New Jersey than in the US average. For a typical state in the United States. It costs about $4,000 more for a renter and about $9,000 more for owners with a mortgage. So the elder index, I'm quite sure, confirms what you knew intuitively, which is New Jersey is an expensive place to live. The other thing that will be clear from these figures and comparisons is that a big part of the story is about housing. And it's especially in terms of owner-occupied housing. Housing is very expensive in New Jersey. Property taxes are very expensive in New Jersey. And so a lot of the high cost of living for New Jersey has to do with housing. Secondarily, it has to do with healthcare. Healthcare is similar to the national average, but it's more expensive than in many other states. Okay. Now, as I said, those New Jersey averages, statewide averages, are really just weighted averages across all the counties in New Jersey. And so here, even though it's a very busy figure, and I apologize for that, I've just listed the elder index values for every county in New Jersey. And again, we're just focusing here for single renters in good health. So the US average is way down here. Okay, for the US average is in gold, and it's just about $25,000 a year. The New Jersey state average is up here in, I guess that's kind of an orange color, and that's about $30,000 a year. And so you can see that there are some counties in New Jersey where the elder index is not tremendously higher than the US average, but there are some where it's substantially higher, and the highest here is Bergen County, where our elder index estimate is $32,000 a year. So you have a huge range, a huge variability of cost of living across counties in New Jersey, aside from the fact that in all cases here, we're comparing single people who live alone, who are renters, and are in good health. So you see a lot of variability there. And in every county in New Jersey, the cost of living is higher than the US average. The additional point I want to make by superimposing this red line on this figure is that, again, Dennis mentioned this in his statement at the beginning, that a lot of times when we think about economic insecurity, we focus on poverty. We focus on metrics surrounding the federal poverty line. You probably know that the federal poverty line is very low. In 2019, for a single person living alone, it was $12,490 a year. Okay, and so this shows very clearly how the elder index provides a measure of how much it takes to get by that is very much higher than the federal poverty line. So much of what we know about economic insecurity is anchored on the federal poverty line, and it's just way too low relative to what it really takes to get by. So that's an important thing to keep in mind as well. Okay, now we've been talking about using the elder index as a benchmark for telling us about how much money it takes to remain independent and stay in your home. But in addition to just using that as a measure of cost of living, we can use the Elder Index to tell us how many older people may be struggling with economic insecurity. And so when we compare the amount that it takes to get by, which is the Elder Index, with the resources that people actually have, we learn that economic security is out of reach for many older adults. And we can conceptualize that with respect to this figure. So again, if we're looking at people along an income distribution, we have now two thresholds that we want to focus on. One is that familiar federal poverty line, and we know that people who have incomes below that threshold are considered poor, and that's what we have a lot of data about, a lot of statistics about. But we also have been talking about the Elder Index as a more realistic measure of how much it takes to get by. And the people who fall below the Elder Index are people who we refer to as economically insecure. There are a whole lot of people who have incomes in between the Elder Index and the federal poverty line. We call those folks in the gap. They have incomes that are in the gap between economic security, between the Elder Index and the federal poverty line. These are people that we, with conventional measurements, we don't know anything about them. They're invisible in a lot of our statistics. They're not information that the federal government collects information about. And yet, because they have incomes below the Elder Index, we know that they are very often struggling financially. Okay, in New Jersey, when we perform those calculations, so when we take the amount of income that people have and compare it to the Elder Index for where they live, in New Jersey, we learned that a large share of older people who live independently have incomes that do not support economic security. And that's especially true if they live alone. Among single women age 65 and over who live alone, more than 6 out of 10 of them have incomes that are below the Elder Index. And that's a little bit higher than single men. So more than half of single men as well as single women have incomes that place them at risk of economic insecurity. Comparatively, it's about a third. So for older couples living independently, again, two-person elder only households, about a third of them have incomes below the Elder Index. And when you combine these figures, you put together the single people living alone and elder couples. When you combine them and do the calculation, you see that it's just over half of retired senior-only households in New Jersey lack the incomes that will insulate them against poverty as they age. I should note that this figure and the next two figures come from a report that was carried out on behalf of the New Jersey DHS, and it was carried out by Rutgers. There are other disparities that we see with respect to the Elder Index in New Jersey. We learned that renters have especially high rates of insecurity, and a lot of that is because renters in general tend to have lower incomes. And so even though the cost of renting, it can be typically higher than the cost of owning a home without a mortgage. A big part of the reason that renters have such high rates of insecurity is because they have low incomes. As well, older persons of color have especially high rates of economic insecurity. In New Jersey, it looks like this. We see more than 8 out of 10 Hispanic or Latino elders. And again, this is a combination of people living alone and couples living independently, having incomes below the Elder Index. 65% of Blacks, 62% of Asians, compared to just about half of non-Hispanic whites in New Jersey being economically insecure. And then when we look at county level insecurity rates, we see once again a wide range of disparities here. I didn't put all the counties on here. That would have made it very busy, but we can see that the insecurity rates in New Jersey range from 75% of, again, singles and couples combined in Hudson County having incomes below the Elder Index, down to 40% in Hunterdon County. I'm sure you know these areas much better than I do, and you're probably looking at these and saying, oh, I know why. I do not know why, but I think that the important point is that in every case, what we're looking at is a balance of the cost of living in that county, in that area, and the kinds of the kinds of resources that the people who live there have. And so when you put those together, you see a wide range of levels of income insecurity across counties in New Jersey. And the point is, an important point is that everywhere throughout New Jersey, a large share of older residents have incomes that fall below what it takes to get by and to stay independent. So I wanted to just share with you, well, I should say first that I understand that some recent reports, reports that the data I just shared with you are based on, I understand that they're now posted to the state website, and so you should be able to get all of this information and a lot more about New Jersey and economic insecurity in your state. If you want to look up the cost of living in New Jersey or counties in New Jersey, compare it to other counties, either in the state or across different states, you can go to our website. Elderindex.org is our website, and all of the Elder Index data are loaded into that. This is just a screenshot. I wasn't quite brave enough to do a live demonstration of the website with you today. But you can see, you just go to the elderindex.org site and you can type in locations that you're interested in, and you can choose what scenario are you interested in seeing. Are you interested in what it costs for singles or couples? Are you interested in renters or homeowners? And what level of health status are you interested in viewing? If you do that for New Jersey, I just did this and took again a screenshot to show you what you would find out. This is a scenario where I wanted to compare the statewide average. So we see New Jersey in the location box, Bergen County, Essex County, and Cape May County. I chose singles, renters in good health as my dimensions. And this is what I got. These bar charts show us what the result was here. So this is what you would see if you requested data for these 3 counties in New Jersey state. When you get that information, I just want to point out so that you'll know if you do go to the website, when you click on these little 3 lines over to the right, it will let you download a PDF of the figure. You can download the data in Excel. You can print things out. So the data are meant to be helpful to you and usable for whatever purpose you may want to use it for. If you go a little bit further down the page on this same request that I'm using as a demonstration, it will give you for each of the locations that you requested some summary information. It will tell you what the Elder Index is on an annual basis. It will tell you how that compares to the national average. So you can see in Bergen County, the Elder Index for the scenario that we described is just over $32,000 a year, and that's 127% of the national average, or 27% more than the national cost of living. And then it also gives you the monthly costs and the monthly total, and you can see it for all of the scenarios or all of the counties. Okay, so this is, that's what I wanted to share with you about the Elder Index, but I wanted to go back and talk a little bit about the short-term financial implications of COVID and what we might be seeing moving forward in the somewhat longer term as well. So before we close, let's talk a little bit about those prospects for elder economic insecurity moving forward. So as the story about the economic fallout of COVID continues to unfold, I think it's important to consider the impacts on economic security for older people. It is certainly too early to tell just what that impact will be, but we can anticipate that the COVID pandemic will exacerbate risk of economic insecurity among older people. And I think that that's going to be true in the short term as well as in the longer term. Something I wanted to share with you was these results from a new Census Bureau data product. It's called the Pulse Survey, and so it comes out of the US Census Bureau. It's a very quick turnaround survey that they've been doing week by week for a few months now. These are data from New Jersey residents, and it's anchored on the first half of September. So these figures tell us that, like everybody else, older people are experiencing financial disruption during this crisis. So reporting again for that first half of September, we see that 4 out of 10 respondents to the Pulse survey, age 65 and over, had lost household employment income since March 13th. Okay, so highlighting that this is employment income that they've lost. So that's a large number, that's a large share. Some of these households will be people who they themselves, even though they're over age 65, they're still working, or they have a spouse still working, or it may be that they live in a multi-generational household. Maybe their college-aged son or a middle-aged daughter who lives with them lost her job or had hours cut back. These data suggest that nearly 30% reported difficulty paying for usual expenses during the pandemic, which again is a high rate of difficulty paying your bills. And a third of them, and again, these are New Jersey residents, in this case, age 60 and over, said that they had delayed medical care because of COVID. So we're seeing a lot of consequences for older people, financial and otherwise, relating to the COVID crisis. I'm not going to share the data with you here, but in addition, the data showed that many older respondents reported high levels of emotional distress. About half of them reported feeling nervous or anxious or on edge over the previous week. Now, some of that anxiety and depression is because of COVID itself, because of things that have happened to their family members or their loved ones. But these financial worries, the concerns about being able to pay their bills, concerns about the state of the world, I think, are also contributing to that sense of anxiety. So clearly, we're seeing short-term impacts of the pandemic on older people. Again, not just in terms of their health, not just in terms of their exposure to COVID, but also in terms of a lot of emotional response, concerns about being able to make ends meet, and disruptions in their incomes. I'm sure any of you who work in the elder services have seen these kinds of situations, have met people and worked with people who are having these kinds of experiences. So this should be of no surprise to you. So those are some of the very immediate implications, but I think there's a lot of discussion now in the literature and the media and elsewhere about what the longer term impacts on economic security might be for older people. And the main resource we have to draw on in thinking about that is reflecting back on prior crises, prior economic crisis situations. Certainly the long-term implications will depend on what happens to the economy, how quickly things bounce back. But we know a lot of things about how prior circumstances have impacted economic security of older people. So one of the things we know from past downturns is that when older people lose their jobs, they take much longer to find new employment. And in that interim period, many of them drop out of the workforce. So we can expect that some of the older people who temporarily lost their job, or they were put on a long-term layoff, or they had their hours drastically cut back, those people may become permanently out of the workforce because they just find it impossible to continue seeking a job. So they're going to become discouraged and they're going to leave the workforce. There may be some declining value of retirement assets. I don't think we've seen much of that so far, but the literature certainly suggests that in past economic crises, the value of retirement assets and sometimes even home values may decline. And so that's something that we may be expecting to see in the future, and that would affect economic security rates among older people. We know from past economic downturns that intergenerational exchanges can be heavily impacted. There's a lot of literature on this from the Great Recession that we recently went through. Many older people do count on at least some level of cash contributions from their children in order to get by. If those children lose their jobs, if those children are not able to make those contributions, then that impact is going to be felt by their older parents. As well, it's been very well documented that when economic struggles impact families, they tend to move in together. And so intergenerational households are likely to increase. And we may see that have economic implications for older people as well. We can anticipate that older people as well as younger people will come out of the crisis carrying a lot of debt. And that is a piece of a factor shaping economic insecurity that's very significant and could be problematic moving forward. And then the last thing I'll mention about this is one of the things that we know is from past downturns is that many people who find themselves unemployed or otherwise experiencing shortfalls financially end up enrolling in Social Security earlier than they had planned. And as we know, when people take Social Security earlier than full retirement age, then their benefit is reduced, and that reduction is a permanent reduction. And so we can expect that's another example of something that will have longer term consequences. So just to wrap up a couple things that I think we've learned about how the Elder Index can be helpful in helping in efforts to support economic security among older people. A big area where I think it can be helpful is through public education and stakeholder education. A lot of older people really don't have a good sense about what it takes for them to get by. They maybe knew how much money they had in the past, but they don't really understand how much money they need in order to stay in their homes or continue to be independent. And so a lot of organizations use the Elder Index for that educational purpose, and they found it very helpful. It's also helpful to educate legislators. It's helpful to educate all kinds of people who have a say in preserving the value of benefits and programs that are in place. I think that we also see the Elder Index being used quite a lot for advocacy. There are a lot of organizations that use it to really promote the strengthening or the maintenance of existing programs and for building new and better programs. So I know in Massachusetts, a lot of organizations use it to promote property tax relief options, and I imagine that's true in New Jersey as well. Really any kind of program that may be seen as, some people or some community members or people at the state level may feel like, well, that's an optional kind of program. Being able to use the Elder Index to demonstrate how important it is and how many people need that kind of support can be very helpful. As well, improving the programs that we have, helping older people find and train for jobs that would help them become economically secure or improve their economic security, helping them stay in their homes, helping them make well-informed decisions about when to retire or whether to retire, helping younger family members think in the long term about what it's going to take for them to be older and financially secure. All of those things are useful programs to have and can be built around the Elder Index. And then also just to evaluate how effective programs are in bringing people closer to financial security. The partnership piece is just something that I know has been very important in a lot of communities, and certainly in Massachusetts as a state. You know, the economic security issue intersects with so many other issues. Veterans organizations have had a lot of interest in it, a lot of nonprofits, and certainly, you know, helping developers and other people in the private sector understand what are some perhaps underserved markets that they could be considering. The Elder Index can be helpful in building bridges with those groups or organizations. So I know we're going to have some questions and discussions now, but I also just wanted to leave you with these websites. You can go to our elderindex.org website to download data about the Elder Index for every county and state in the U.S. We have a lot of reports and information about economic security and the Elder Index on our UMass website. If you go to UMass Demography of Aging, you can email us at csdra@umb.edu to sign up for notices and updates about the Elder Index, or you can just reach me directly by email, jan.mutchler@umb.edu. And that's my presentation, and I look forward to the discussion.
Terrific. Thank you so much for that, Jan. It was really great, and hopefully everyone has has walked away with a better understanding if they didn't already know about the Elder Index. But you know, and hopefully we haven't put too much of a damper on their Thursday with some of our data. So, Dennis, I did want to throw it back to you to fill in any New Jersey specific information, or to comment on anything that Jan said that relates specifically to New Jersey. So.
Sure. In 2015, as Melissa said, state law passed that handed this responsibility from the New Jersey Foundation on Aging over to the Department of Human Services. And to date, we have posted on our website 3 of those sets of reports. And one, you've actually got a preview of the 2019 here. Our 2019 report has not yet made it through all the approval processes. We hope to have that done shortly. But our last reports that we have on the website are based on the 2018 data. And we continued what the foundation did, which is produce 2 reports for each year. So we have the Elder Economic Security Index that you heard a lot about today. And then that last slide, it said one of the things we want to do is educate people about the programs that can help them strive toward or reach that elder economic standard. And that's a report that's called Living Below the Line. And we've continued that after the New Jersey Foundation on Aging does. And it talks about the impact of programs like SNAP, our Senior Freeze program and Homestead Rebate, and our PAAD, which is a program kind of unique to New Jersey, as well as Senior Gold. We have 2 programs that help people afford their medications. And both of those income levels are rather high, especially compared to the federal poverty level. So these programs all can sort of patch together and help people get closer to affording to live in New Jersey comfortably. So those reports are on our website, and I don't have a slide to show you, but we do have a shorter URL for us, which is aging, as in getting older, .nj.gov. And then on the left-hand column, we have a link that says reports and publications. And if you were to go to that page, you'll find the 3 that we've produced at the department, and the ones that the foundation has produced in the past are still on their website, I would believe.
Yeah, so I was going to say that the original reports are on our website, as well as a link to some of the reports that the department has released. Dennis, can you just tell me that link, that shortened link again? I'm going to type it in the chat box for folks. Was it aging.nj.gov? nj.gov. All right, I'm typing that in the chat box for everyone to write down, but we'll be sending out a follow-up email with the link to this recording with Jan's slides, and we can throw that link in there and any other information, Dennis, that you'd like to pass along. I know that some of the programs you've mentioned, people can find out more on your website and also through the NJ Save application, correct?
Yes, yeah, NJ Save is a newer type application we've developed in the last few years. It's online. We actually now have received 9,000 online applications just the other day. Since we launched this, I think it was November of 2018. We still have the paper application because people like paper, and that's wonderful. But through one application, we can enroll them in anything they're eligible up to, I think it's 8 or 9 programs that are in there. So if you're eligible for PAD, we'll sign you up for that. If not, you're higher income, then we'll sign you up for the senior senior gold program. But also then share that data with the low income home energy assistance program, with the Universal Services Fund, and then they will enroll you in the program using the data that you've given to us, so you don't need to apply twice.
Yeah, and I think that's a great thing about the Living Below the Line report, because it does talk about how some of these programs specifically are helping to keep people out of poverty or helping them to reach a greater economic security. And so we want to make sure we're lifting up the pharmaceutical programs, the LIHEAPs, the Medicare savings programs, all of those things that are helping folks. So I appreciate you sharing that information. We do have a couple of questions in the chat box that I want to ask to both of you, specifically in regard to the New Jersey data. I know there is some interest in knowing whether or not the elder index percentage is by selected county. And so I know we have the Jan, the cost of living is broken down by county, but Jan and or Dennis, is the other information, that demographic, is that also broken down by county?
The report that Rutgers did, that I shared a couple slides from, has a lot of information by county. I did show at least one slide based on that. So I'm not positive that it's done for every single county, but it is done for most of the counties. And again, it's in those reports. So yeah, there's good information at the county level for New Jersey.
Great. And then I think I know the answer to this question, but just to confirm, when we think about the expenses of utility costs, that's included in the housing estimate, correct? Not it. Yeah.
That's correct. That's correct. The housing includes, it's rent, it's a mortgage if you have one, it's the utilities, it's property taxes, it's house insurance.
Yes.
Yeah.
Terrific. Terrific. And then I do believe we have another question from Julia Stambos at the Henry and Marilyn Taub Foundation. So thanks so much, Julia, for joining us. She asks, is there a breakdown of the county level data by race, ethnic background, which I think we talked about briefly, and by age within the older adult category? So this is actually a good question, because we have talked in the past about whether or not there's a difference in the economic security of people at the age of 60, at the age of 70, at the age of 80. So is there a breakdown in the New Jersey data based not only on race and ethnicity, but also on age category?
Dennis, do you have any recollection of if that report includes that level of detail? That's not a report.
I think in living, I think in Living Below the Line, there might be some references to it, but it definitely wouldn't be broken down to the county level, or, you know, it might be a passing reference that we understand that people at age 85 plus are more likely to have, you know, higher healthcare costs, for instance. And that might be the end of that statement. I don't think it'll be the kind of detail that we have for the general.
Right, but it is referenced in the report that, you know, that we know that the longer people live, the less and the further away they are from their earning years, the more likely that they might have economic security issues. So at least it's covered.
Yeah.
And then we have a comment from Eileen Doremus from the Mercer County Office on Aging. Thanks, Eileen, for joining us today. She just wanted to let us know that the Elder Index tool has been undeniably one of the best tools for the Area Agency on Aging to use in their planning, as it spells out for our communities the reality of making ends meet, and as was previously suggested, tells the real story of those in all socioeconomic scales. So it's nice to know, you know, that it's being used and useful to those who are serving the older adults in our communities, and that they find it a valuable tool in planning and in telling the story of those that they're trying to serve, which I think is ultimately what we want. So thank you, Eileen, for sharing that. So glad to know that you all still find the information useful, and that you were here today to hear more. So that looks like it might be the end for right now, but if anyone else has any last minute questions or comments, please do type them in the chat box before we let our guests go. Again, Jan and Dennis, very grateful for you sharing your time, because I do think that this is really important information for our audience to hear about. And as I said, we will be sending out a follow-up email to everyone on the webinar today with a link to the recording, with Jan's slides, and with the links that Dennis has provided, where you can find information about the reports, as well as the services and programs that are provided by the state to address some of these issues. And if there's anything else, Dennis, that you'd like to share, please send it to me and we'll pass it along to everyone so that we make sure they're getting all of the information about what's happening in New Jersey. And we do encourage everyone to please continue to use the tools, to go to the website that Jan referenced, elderindex.org. Yes. Yeah. And you can search, you know, for national data for anywhere in the United States that you'd like data on, that's where it's available, and also the New Jersey reports to get that information about specifically what's happening here in New Jersey. And as always, please do feel free to reach out to us at the New Jersey Foundation for Aging as well, to help connect you to this information, as well as provide any additional information about the use of it. So we're happy to do that. It doesn't look like any new questions have come in. So I thank everybody for their attention and for their questions, and for, again, Jan and Dennis, for your time and information today. This was really a wonderful day for me to get to see you both and to get to talk about the Elder Index. So I wanted to thank you all for that. And with that, we'll be following up, as I said, via email. But if you have any other questions or concerns, please do reach out to us. And please do visit the Foundation's website, as well as our social media channels for other updates, for more webinars and other things that we'll be doing. Don't forget to watch Aging Insights. All right. Thanks, everybody. Have a great day.
Thank you.